overdose. So we're really excited today that we are joined by Captain Matt King. Captain King is coming to us from the St. Clair County Sheriff Department. Captain King has 24 years of law enforcement experience. He's worked in the Drug Task Force, the Road Patrol, and has 20 years on the Special Response Team. Matt's been in many narcotics investigation schools. He has advanced training in law enforcement through the MSU School of Staff and Command. He's also attended the FBI National Academy. So with that, we're very pleased to have Captain King over with us today, and we're going to turn it over to him.
Hello, everyone. As my introduction indicated, my name is Captain Matt King, and I've worked at the Sheriff's Office now for 22 years. I'll give a brief background of my experience at the Sheriff's Office so you understand where my point of view is coming from. So I've worked at the Sheriff's Office again for 22 years. I've worked as a deputy, sergeant, and lieutenant all out at the Drug Task Force, approximately 9 years total in the Drug Task Force, and again, 20 years on the Special Response Team. So I've been involved in narcotics investigations throughout the years as a deputy, sergeant, lieutenant, and again, as a deputy, sergeant, lieutenant, and captain at the Drug Task Force. I also spent 2 years in the Detective Bureau as the detective lieutenant, and I'll talk a little bit later on about how property crimes and other crimes correlated with the rise in the use of opioid drugs in St. Clair County. So we'll get started here. I want to give a brief overview about what I'm going to talk about today. We're going to talk about the trends of the drug problems here in St. Clair County. In the 90s, 80s, 90s, and 2000s, it was more cocaine and crack cocaine and other psychedelic drugs. And in the 2000s, we saw an uptick in the opioid pain medications. I'm going to talk about how in the mid 2000s, the transition from cocaine to pain medications then went on to a heroin problem in the county, and how we saw that whole situation kind of roll out in front of our eyes. In the mid 2010s, heroin was definitely the drug of choice in the county and really nationally. We saw an uptick of other synthetics being mixed with the heroin, such as fentanyl and carfentanil. And we'll talk about how that created a big problem with uptick in overdoses and in actual overdose deaths. We'll go on and talk about other trends and some other experiences I had while working with the Drug Task Force and some things I saw. I'm going to start out with kind of a brief overview on how things rolled out on a national level, and then we'll recap kind of at the end on how things happen here in St. Clair County. So the history of the opioid epidemic. In the 1990s, the pharmaceutical companies had claimed that opioid painkillers were a great drug with little to no addictive properties. There was an increase in prescription of opioid pain medications by doctors, thinking that they're helping people with injuries manage their pain, and without really realizing that there was a very strong probability that people would be getting addicted to the drug itself. We saw an increase in both prescription and non-prescription opioid use after that. People were using the medication often as it was prescribed, and then turned on to being addicted to it. And there were other people using the drugs, even if they weren't prescribed to them, thinking they were safe because they were prescription drugs and not street drugs, and they also became addicted and moved on to other drugs such as heroin. The pattern of misuse kind of indicated to the public, hey, there's a problem here. This is not a safe drug to just give out for minor injuries, and that there had to be some steps taken to increase the safety with the prescription of these drugs, and to stop the increased amount of people who are addicted to these drugs. And in 2017, Health and Human Services declared opioid addiction a public health emergency, and they announced the 5-point plan. The 5-point plan included what's listed on the screen: better addiction prevention, better data, better pain management, better targeting of overdose reversing drugs, and better research. So some of the things that really stick out was they realized, hey, this is an addictive drug. We need to take steps in deciding whether or not we're going to prescribe the drug. We need to follow the use of these drugs and come up with other pain management. And a big thing with the admitting that there was a problem was when they really started pushing the use or the availability, I should say, to Narcan, which is a reversing drug that blocks the receptors in the human body from taking in the opioids and slowing and or stopping an overdose. So we saw the trends throughout about a 15, 16, 17-year timeline where the amount of prescription opioids that were being prescribed had really risen. The MMEs, morphine milligrams equivalent, that's how they measure how much actual opioid is in a prescription. And you can see between 1999 and 2015, the amount of per person prescribed opioids had tripled. We knew at that time, of course, we knew before that, that this was a big problem and we had to control the amount of opioids that were being prescribed to begin with. Overdose in the US had increased hugely throughout that time frame. So we knew at one point when the heroin had taken off that the opioid pain medication that had been prescribed had turned people on to these the addictive properties of opioids, and then having people turn to heroin and other drugs to get their opioid high. We found that the people oftentimes were prescribed drugs from their doctors, became addicted to them, and once they couldn't get enough of them, or maybe the doctor stopped prescribing them, they turned to the streets and started buying pills off the streets. Later, I'll talk about the correlation and the timeline of how that rolled out in St. Clair County, but it was a nationwide trend. And when people couldn't get enough of the opioid pain medication, they turned to heroin. And at that point, we saw a huge uptick in opioid overdoses. And the opioid overdoses weren't always heroin or heroin laced with fentanyl, but it was also oftentimes a mixture of prescription pain medication that included other psychotropic pills along with opioid pills. We saw, again, a large uptick in overdose deaths. You can see by gender, there's not a big difference between male and female, but between the years of 1999 and 2018, we went from under 20,000 drug overdose deaths to nearly 70,000 drug overdose deaths. So obviously, a tripling in overdose deaths showed a huge problem in our nation. And we could see that 70% of the overdose deaths involved some type of opioid drug, may it be prescribed or a street drug like heroin or fentanyl or carfentanil. At that rate, we saw with a 70% increase of overdose deaths that we obviously had a problem, and we knew exactly what was going on. We knew people were getting addicted to these pills and moving to heroin and then running into heroin that was laced with fentanyl or carfentanil and having huge amounts of overdoses. Again, we saw the trends start to change here in 2017. But to go back to the prior slide, we knew that we had to take action in law enforcement as far as our reaction to this overdose and this opioid problem. We had so many people getting addicted, not even intending to try a mind-altering drug, oftentimes just taking the prescription drugs that were given to them. And then we saw the opioid problem turn into a heroin problem. In law enforcement, our job primarily is to enforce the law, but we realized we needed to be a bigger part in the overall fix or the overall attack on the opioid epidemic. And we began to get involved in other programs. And one of those programs was the naloxone or Narcan program. It was a program put together locally by the health department, but obviously throughout the nation by many different departments, where we knew we needed to get life-saving, basically antidote drugs from these overdose of opioids in as many hands as we can. Law enforcement, fire, EMS, and of course medical people began to get trained and carry these drugs, the Narcan, around with them. And that's why on this slide, you can start to see a downtick in some of the overdoses, but you see an uptick on heroin being involved in the overdoses that are laced or mixed with synthetic narcotics, usually drugs such as fentanyl. Locally, we began to see clusters of people who had overdosed in a very short period of time. We would later find out why that was. We would get calls. I remember working in the drug task force and scanning EMS and fire radios, and of course, regular dispatch. Now, keep in mind, we're working in plain clothes, so we're kind of able to get through the neighborhoods without being seen. And we would hear and see of people overdosing in large numbers in a small area. We quickly learned that was obviously not a coincidence that a drug dealer had come into the area, sold 6, 8, 10, 12 people what they think is a regular pack of heroin that is laced with fentanyl. They, being the user, uses the normal amount that they are addicted to using every day, or at least that dose. And it turns out it's much stronger because fentanyl is much stronger and it was laced into the heroin. And at that point, we took another approach and began trying to get interviews with these overdose victims to try to find the dealer, to find out who was dealing those drugs and go find them out in the street and get a hold of them before it continues to prescribe these drugs, sell these drugs and have people overdose on them. So that's kind of a quick overview on how things went out nationally. Now in St. Clair County, we saw a slow rollout, the opioid epidemic that is, in a way that we really didn't know what we were seeing. Drug task force began to see increases in people selling narcotic painkillers and other prescribed. We're back. Sorry about that. Zoom, you gotta love it. So I was just getting into the effects in St. Clair County and how how my experience out of the drug task force kind of gave me a firsthand seat to see the rollout of how opioid drugs had become an epidemic. I would say in the mid to early 2000s, probably 2005-ish, we began to see a lot of prescription drugs in drug raids. Even though they weren't necessarily part of the initial investigation, we saw a large amount of opioid drugs being in the same location at a time. And shortly thereafter, we began to get approached by people giving tips, our informants saying, hey, there's a lot of people selling a lot of prescription drugs. We began investigating those sales, and it turned into several drug investigations and execution of search warrants where we went into the residence and we'd see large amounts of painkillers being prescribed to the same person, or perhaps one person being in the possession of a large amount of painkillers, usually Vicodin or Oxycontin, and to find out that they were selling these on the streets because people become so addicted to them. Shortly thereafter, we started to see heroin. So we really didn't have much heroin in the area before that at all. So when we started talking about heroin investigations, we were kind of stumped because it was rare to see heroin in St. Clair County before that. As people knew already heroin was such an addictive drug, everybody kind of stayed away from it. And after that, we began to see our overdose numbers spike. And again, at that point, we knew that there were problems with the heroin. People were getting too much. And later we found out that people were using heroin spiked with fentanyl and carfentanil. All at the same time, we saw a big uptick in home invasions and other related property crimes. I'll talk about the fact that we realized as law enforcement we had become part of the recovery community and help with fixing the overall problem, but we couldn't ignore the fact that the use of opioid drugs had caused a lot of other crimes to spike. So it isn't a victimless crime. Obviously, people were stealing things, breaking into buildings, committing robberies to get money to go buy their drugs because they were so addicted. Fentanyl and carfentanil appeared in St. Clair County once heroin got to be very popular. Now, when we began to realize that heroin was a problem, of course, law enforcement started to have schools and other educational forums for us to learn about the epidemic, learn about heroin itself, learn about how the sales go, as it was somewhat new in the drug world in St. Clair County, or at least it hadn't been around in a very long time. We learned that heroin had become so popular that some of the people who had grown coca plants to make cocaine had burned half of their fields and started growing poppy plants. When you know the drug cartel are creating fields to grow a crop in which it takes to make the product that is becoming a problem. You know, it's huge. They're like a business. They knew there was more profit in this, and they began to create fields or eliminate fields of coca plants because the sales of heroin were so high. After the heroin really boosted, we saw a lot of fentanyl starting to come in the area. Now, most of the people that had started using heroin were, again, got addicted to opioids by prescription drugs. And when they couldn't get those, they moved on to heroin, and heroin is up to 5 times stronger than morphine. Fentanyl is a synthetic opioid, and it does not take a crop to make. It's all chemicals, and it masks and does pretty much the same thing as any other opioid would do. However, it's much more powerful. Fentanyl is up to 100 times the potency of morphine. So you see the problem there. And then you have carfentanil that is 10,000 times the potency of morphine. We did have confirmed cases in St. Clair County where heroin was laced with fentanyl, and we did have confirmed cases of heroin being laced with carfentanil. The fentanyl became a large problem again when we saw the large groups of people who were overdosing in a small area in a small time frame. Obviously, again, we knew that dealers had laced their heroin with fentanyl. What was happening is the dealers, or somewhere down the line in the dealer chain, somebody was mixing fentanyl in with the heroin. Well, these people aren't chemists. They don't know how much fentanyl to mix in with the heroin. And of course, they made a much more potent dose, and people were dropping of overdose. The other problem was the one-time naloxone or Narcan use that most police and EMS had was not working because the overdose was so powerful. We interviewed victims of these overdoses and found that not only did they have to get hit with 3, 4, 5 shots of Narcan to get them out of their overdose state, that when they were put in the hospital, they're actually put on a Narcan or naloxone drip to stop them from continuing to overdose. We had a lot of people die from the fentanyl-laced heroin. And in fact, in the Sheriff's Department, the Drug Task Force, and other law enforcement agencies were able to put a charge on a local drug dealer, which was delivery causing death, as he delivered a packet of heroin suspected to be laced with fentanyl that killed the subject, and we were able to work that backwards and convict him of delivery causing death. Again, you know, in law enforcement, we knew that we had to be a part of the solution other than just arresting our way out of this opioid epidemic. But we couldn't ignore the fact that there were a lot of victims in our county and throughout the state and nation, of course, of property crimes related to drug users needing to get money to buy their drugs. They're so addicted they would do anything. We saw a huge uptick in property crimes, and if you line it up with the amount of overdoses, you see it's a direct correlation with the overdoses rising, people becoming more addicted to the drugs. We saw a huge uptick in property crimes. So we wanted to be a part of the solution, but we also had to be part of the solution for the victims who had their things stolen or broken into, or robberies that were conducted. Narcan use by Tri-Hospital EMS, you know, from 2015 to 2019, those numbers are down. That's a good thing. We also are not naive to the fact that it's not just because there's less overdoses. The Narcan First Chance Naloxone program that was put out put the naloxone or Narcan into the hands of all first responders and the public as well. Loved ones of an addicted person could get their hands on naloxone or Narcan, which was good in case they came across their loved one who was overdosed. They could administer that drug to get the overdosed person out of their overdose state while EMS was on the way. We did see some problems with the naloxone being distributed so widely. All in all, it's a great program and it has done a lot of great things, but a couple of the negatives that we saw was some people were using heroin or an opioid overdose. They had a loved one give them the naloxone, and once they came to from their overdose state, they didn't go to the ER, emergency room, or a doctor, and the opioid was still in their system. Narcan does not get rid of the heroin. It blocks the receptors from absorbing it. So if you have enough heroin or opioid product in your system and you get a shot of Narcan and that Narcan gets processed through your body, you can still overdose on that first hit or injection of heroin that you took. Other problems included after interviewing users, several of them would get with another user. One person would have the naloxone and one person would try to get as high as they could without overdosing, oftentimes overdosing, knowing that it was okay and safe, and then just having their friend shoot them up with naloxone. Hopefully their friend didn't end up doing the same as them. But overall, a very good program. Who becomes addicted? With the opioid epidemic, it was such a new and different drug epidemic. People in St. Clair County, of course, throughout the United States as well, again, oftentimes were prescribed medications and then became addicted to these addictive drugs and then moved on to heroin because they couldn't get their hands on the pills anymore. Throughout the United States, of course, locally as well, there is no demographic, there's no age group, there's not a more prevalent with males or females. It has nothing to do with your background or your upbringing or where you lived. It is an epidemic that has gone throughout the United States. I know personally a friend in high school who I didn't know till years later had a knee injury and was prescribed Vicodin at the time. Again, went to school with the kid, never knew it. And years later, I found out he became addicted to these pills. We were really stumped at the Drug Task Force as to how people just decided to pick up a needle and start shooting heroin. And again, when this was all rolling out, we didn't know what we know now. And through interviews, we learned a lot. I remember interviewing a suspect who we had arrested for possession with intent to deliver heroin. He was selling heroin to pay for his habit. And I just sat down and talked to him, and he was very honest and frank, and quite frankly, a really nice guy. And we had a conversation. I asked him, how in the world did you start shooting heroin? It's at the time, I don't know, it was maybe 2012 or something like that, maybe earlier. But, I said, people know that heroin is addicting. You don't use it once. And he kind of looked at me like I was stupid, basically. And he explained, he said, I didn't start using heroin as a decision. He said, I was married, had a kid, I worked as a mechanic, and I did side jobs. He had a very good job, owned a home. He did side jobs to make extra money, and he was doing a transmission job where he went to move a transmission and hurt his back. Picked up something very heavy and hurt his back. Probably happened to most people watching this video. He goes to the doctor, gets some pain medication, which was Vicodin. He says it works fine. It's not disrupting my life. It's covering the pain. I'm able to go back to work. I got to pay my bills. But over time, the prescripted amount wasn't enough. I began trying to get my prescription filled earlier than I'm supposed to. And at one point, he's buying a little extra on the street because he needs more than what's prescribed. The doctor eventually tells him, I can't continue to prescribe you these pills. You're gonna have to go maybe see a surgeon or see what a better fix is. Well, at that point, he was already addicted. He began buying his drugs on the street, and his wife obviously had seen a change in his behavior and his habits and had talked to him about possibly the fact that he was addicted to these drugs. Basically, his wife put more and more heat on him until he decided, okay, I'm not going to take these pills anymore. While doing another side job, he was working on a vehicle and became very sick. He was withdrawing. He really didn't know what was going on, but he knew if he could get maybe his hands on a Vicodin, it would take the edge off. He described it as having the worst flu I had ever had times 100. Pain, chills, sweats, nauseous, everything. He went to a local bar where he had bought pills before. He could not buy any pills. Nobody had any, but somebody did offer him some heroin. He said he snorted the heroin and he immediately felt better. He wasn't sick anymore. Of course, he was also feeling better because he was high from the heroin, and he advised at that point he knew he was addicted. He was an addict. He advised that shortly after buying the heroin and snorting it, he began injecting it, and within 6 months, he had lost his home, his job, and his wife. That is indicative of the story that is the story of people who become addicted to heroin and opioids. Oftentimes, nobody intends to misuse them. Nobody thinks there's anything wrong with them. We saw teenagers taking pills that maybe their grandparents or parents had in the cupboard, thinking, hey, I get a good high, and it's safe because it's a pill prescribed by a doctor, and becoming addicted to those pills and going down a rabbit hole that they just couldn't find themselves to get out of. When we saw the pill addiction turn into heroin addiction, we saw the uptick in the overdoses. 80% of heroin users start their opioid addiction with prescription pills. And that just tells you right there, we have a problem that we know how it starts, and it is controllable. Oftentimes we can't control who tries meth or cocaine or crack, other than hopefully parental guidance and social guidance. But when we're prescribing the very pill that's starting the problem, we knew there was a way to start working on fixing the problem. And fighting the prescription problem at a federal level, we saw things roll out where we realized, hey, we can't continue to stand by and pretend this isn't a problem. We know where the problem is starting, and we need to start doing something about it. And there are several programs and laws passed, and really one of the big ones was in 2007, when the development of risk evaluation and mitigation strategies were kind of said out loud. We realized in the medical field, I guess, and in the world itself, we need to measure the good and bad with prescribing these drugs. Is there a better way to get somebody through their pain after a surgery? Maybe they just have to be in some pain for a while, but it's better than the end product of large amounts of people becoming addicted to opioids. So the FDA started monitoring patients and their access to these drugs. We try to educate the public about the fact that, hey, these drugs are dangerous. Personally, I know my kids were teenage age when this stuff was starting. You want to educate your children to say, hey, if you're at a party and somebody offers you a pill just because it looks like it's a prescription drug and safe, it's not. In fact, it could be one of the most dangerous things you could take. Increasing tracking and monitoring the controlled substance was very important. We needed to get a lid on people from getting these pills and going to another doctor or going to a doctor's office that what we consider pill mills that are just pumping out pills. In the drug task force, we began to see a lot of the same doctors' names on these prescription pills, and in fact joined with the DEA and did an investigation on several local doctors. One, we did actually an exclusive search warrant. He was running what we consider a pill mill. People were driving all the way from Tennessee, North Carolina, driving all the way here to get those prescriptions filled. And that showed that in the number of prescription pills that were being prescribed, and of course some undercover work showed that this person was running a pill mill. We did prosecute the person, and that doctor no longer has his license. So that was kind of one of the first steps. We had to stop the source of the opioid addiction, and then work on, the addicted and getting them treatment and things like that. Michigan prescription drug monitoring was really big. It started to keep track of who was prescribing drugs, who was getting prescribed the drugs, and what pharmacies weren't monitoring how much of these opioid pills were being prescribed to the same person. It was a big step in tracking, again, stopping the whole idea of being able to doctor shop and go to different doctors and get these pain medications because you're addicted. And it also kind of sent the message out. Again, 99% of the doctors were doing everything they felt was right, but there were a percentage of doctors who were turning into drug dealers themselves, running pill mills. So it was important to get out ahead of this and make it difficult for the doctor shoppers and the misuse of these drugs to even get started. We knew in law enforcement and other professional fields that first thing we had to do with the opioid epidemic is stop the growing amount of people addicted. If we can stop the growing number of people amount addicted and treat the addicted, we can start making some headway. And that's kind of what has happened through some of these laws and actions and plans is to stop the growing number of addicted people. Again, we knew how they were getting addicted. We knew how they're getting the drug that addicted them, and it was controllable. So that was one of the most important things that we started to see and work on. And of course, lawmakers in the medical field did as well. So the law enforcement in St. Clair County and how we attacked the opioid epidemic. Again, I talked about earlier, we became trained in naloxone or Narcan use. We started carrying the Narcan around. At first, really, the thought was that some of these synthetic opioids like fentanyl and carfentanil were so easily ingested, oftentimes accidentally through your skin or inhaled, that we were wanting to protect ourselves or our partners if we were to come across a substance and inadvertently ingested the carfentanil or fentanyl and were overdosed. By that, we could inject the naloxone. But again, we carry it and we've used it probably weekly in law enforcement in St. Clair County for years on people out on the street. Naloxone standing order was passed. People were able to be trained and get the naloxone in their residence so that if a loved one did overdose, that they could administer the naloxone and call EMS and wait for help. That saves lives, and it saved a lot of lives, in my opinion. Of course, the numbers show that as well. And in Michigan enacted the Good Samaritan law. We were having problems with people overdosing, and they were using drugs with another drug user and didn't realize or didn't want to call police because they didn't want to get in trouble. And the second chance the Good Samaritan law made it safe for them to do so without worrying about getting charges and getting medical help for their addicted loved one. Again, in law enforcement, we had worked through the enforcement part, of course, the epidemic, but we also knew that we need to become more involved in the overall picture and healing of the community of this epidemic, while continued to be the enforcement arm of the public and enforcing the laws and arresting drug dealers and people for committing property crimes. We also got involved in other community groups like the Executive Overdose Committee, Families Against Narcotics, and Hope Not Handcuffs. Hope Not Handcuffs, several law enforcement agencies throughout the county have been able to be a part of this group. And what it is if an addicted person finally realizes they need help, they can go to that law enforcement agency, wait in their lobby, and somebody will in the agency will call what they call an angel, and the person will come and give that person a ride to a facility that will help them with their addiction. So when the opioid epidemic really jumped off, the Sheriff's Office Drug Task Force saw an increase in drug use between heroin and methamphetamine and meth labs. We had already been working very hard in the Drug Task Force combating other drugs such as crack cocaine, powder cocaine, and other psychedelics. But we saw an increase in drug users and an increase in problem with the opioid epidemic, as well as methamphetamine. So for the first time in 30 years, we approached the county residents and requested our millage be doubled so we could get more manpower. Again, heroin use and sales had spiked, overdose had spiked, meth labs had spiked as well. Methamphetamine labs are very taxing on the Drug Task Force, as it takes hours and hours, especially trained deputies, to dismantle these labs. And it was just, it would take up a whole night if we came across one lab while we were taking apart this meth lab. So we needed more people to be able to combat these problems, and as well as combat other problems that came along with the Drug Task Force or the drug epidemics, which is the property crimes. Through the years, we saw the ups and downs of the seizure of pills and pain medications. You can see a very large spike in 2017, and the amount of pain medications being seized kind of went down. Heroin continued, though. People had transitioned from pain medications to heroin, but people would still use the pain medications, opioid ones, that is, to get them their fix until they could get their heroin. So we see some headway with the trends at this point with heroin. And again, the heroin spiked in 2017 as far as drugs seized at the Drug Task Force. So usually a pretty good indicator as to what's going on out there in the drug world. We can see some great improvements in 18 and 19, and we hope they continue. The downside is we also know that methamphetamine is huge. I talked earlier about the drug world and the drug cartels being smart about how they sell and create their drugs. While heroin may be down, and back in the, when heroin was spiking, they had cleared out fields of coca to grow poppy plants to make the heroin. While the drug cartel also saw a spike in meth labs and meth use in the United States in the early 2010s, 12, 13, 14, 15. At that point, they began making large methamphetamine labs. They flooded the border down the southern border with methamphetamine at about a third of the price. You could get a kilo of methamphetamine at the border for about $7,000 when cocaine or heroin by the kilo would cost anywhere from $22,000 to $30,000. So they created their own market. They created a cheap drug that they didn't need a plant or crop to make because it's all synthetic, and they flooded the market. So at this point, the trends of heroin use and opioid use is going down. I think probably because of the concerted efforts by the medical field and law enforcement and other agencies throughout the United States, and of course locally as well, but also because of the influx of methamphetamine. To interviewing people at the Drug Task Force, we're learning that people are going to methamphetamine to get off heroin and going to heroin to get off methamphetamine. Heroin and methamphetamine are opposite drugs. Methamphetamine is very much an upper, it's a stimulus. It's very, very powerful. People are up for several days at a time. Heroin is the opposite. It is a depressant and a hallucinogenic. And people oftentimes will take some heroin after they've been on methamphetamine for a couple of days because that's the only way they think they can sleep. So we're still seeing a large problem with drug use. It's a fluctuating problem, and the opioids are certainly not gone by any means. You can see in 2016, we were able to double our millage at the Drug Task Force, and it took about a year to get people on staff, and you can see the skyrocketing numbers of drug rates and drug arrests. So to recap, in the early 2000s, crack cocaine was our problem, and we saw the influx of opioid pain medications that moved on to heroin and other synthetic opioids. Prescription pills were more and more present in the early 2000s, and then by 2015, heroin was the biggest drug in the county. The amount of addicted people was consistently growing. Property crimes were growing, robberies were growing. So we saw a really big problem where not just the users, but of course the families of the users and people who own property and businesses were really getting affected by this drug addiction. Sales of heroin became the priority in St. Clair County Drug Task Force. We used to say that the heroin use, anytime you used it, it could be the last time. Other drugs, not that they're any less dangerous, but they kind of chip away at you. So we realized we had to get a handle on this drug epidemic with the opioids and the heroin because, again, anytime somebody used it could be the last time. That was one of the reasons why naloxone was so important, because every time somebody's brought back from an overdose, we looked at it as an opportunity for that person to get treatment. In 2018, heroin use, or at least the seizure of heroin, seemed to drop significantly, but methamphetamine is the most popular drug right now as far as our work at the Drug Task Force and law enforcement in the county. Again, heroin and opioids are still a huge problem, but now we have another drug that is really, really powerful that is taking over people's lives. With that, I'll open it up to questions.
Okay, we've had a couple of questions come through in the chat, a lot of which you already answered, which is awesome. One that I wanted to put out there is, what does St. Clair County need to work our way out of this historical problem?
So, it's a good question. What does St. Clair County need to work our way out of this problem? Just to continue educating people, continue to fund the programs that are helping people get better, and to continue to attack the number of people addicted. And I talked about that earlier. It's very important to know, we know where the addictions are starting for the most part. With opioid drug addiction, we hadn't found a lot of people second, third generation users yet. We're starting to see that. And what I mean by that is in the drug world, it's unfortunate, but oftentimes we do a drug raid, we find a drug dealer or user inside the residence and find out that person's mother or father or aunt and uncle or caregiver when they're younger were a drug user of the same choice. And they may have been introduced to this by their family or at least their environment. With opioids and heroin, we weren't seeing that. We're seeing a little bit of that, but we knew that we had an opportunity to get in front of this problem before it became a generational problem. And that's why when I talked about stopping the amount of people addicted from growing, so you want your number of addicted people to grow because the ability to get that drug is still out there, was so important. So first of all, continue the programs to help people to get off the drug and get healthy. But really very important to stop the number of addicted from growing so that we don't have these second and third generation of drug users. And then that problem, it becomes very, very difficult to corral in and bring back down to zero.
Another question we have is, what trends are you seeing within our county as it relates to youth?
As it relates to drug use?
As it relates to youth and
I'm sorry.
substance
Okay.
use.
So, a big issue right now, and it's controversial because people have different feelings about them, is the use of marijuana. Again, it's legal recreational now, but not for people under age. And there's a reason for that. People of underage, their brains aren't fully developed and they react to any substance differently than a fully developed brain. These properties are mind-altering properties, and they open the door for youth to make poor decisions, perhaps try other drugs while they're at it. Again, somebody's at a party, they smoke some marijuana because it's getting to be more socially acceptable, even though they're still breaking the law because they're underage. And then they're introduced to an opioid painkiller. They look at it like it's a pill, and that opens the door for them to really get affected by other drugs in getting addicted to other drugs. The other problem we see is people smoking marijuana and thinking they can drive, especially youths. So it becomes a very dangerous thing. When the medical marijuana law opened up, we saw a large uptick in people who were driving under the influence of marijuana and accidents and traffic collisions and traffic stops and arrests that way. So with the opening up and the somewhat social acceptance of the use of marijuana, we're seeing more kids getting their hands on that drug when they're not capable of really processing it and making good decisions while under the influence of them.
Okay, we have just one last question. I'm actually going to touch on it before we hand this back to Adrian to do our wrap up. Someone had asked what the executive overdose committee is. It's actually the executive oversight committee, and it's just a group of leaders of different service providers that get together and work on combating the opiate epidemic from different perspectives: law enforcement, mental health, education, things like that.